Chronic kidney disease. In this presentation, we will be exploring the pathophysiology, manifestations, and treatment related to chronic kidney disease. This disease is the gradual loss of renal function caused by the destruction of nephrons that leads to hyperfiltration and uremia. This disease is primarily caused by diabetes and hypertension. It's important that we screen for CKD in those who are at risk. Diabetes accounts for 27.7% of CKD-related causes. The pathological stages of CKD are reduced renal reserve, where 50% of nephrons are lost without signs and symptoms showing. The second stage is renal insufficiency, where greater than 20% of nephrons are lost, causing decreased GFR and increased BUN. The last stage is end-stage renal failure, where less than 20% of nephrons remain. This causes a severe reduction in GFR and tubular function, with marked azotemia and failure to concentrate urine. Kidney failure has remarkable systemic effects on the body due to the accumulation of waste products and excess fluids. Normal kidneys become scarred and fibrotic. With extensive damage to the kidneys, they shrink and are unable to properly function. There are multiple risk factors in CKD that lead to the destruction of nephrons. Certain ethnicities, such as Indigenous, Asian, and African, are at greater risk of developing CKD. The loss of nephrons leads to hyperfiltration, proteinuria, and polyuria that progresses into anuria as the nephrons become overworked and damaged. The damaged kidneys result in decreased GFR, anuria, and uremia. There are multiple effects on the body caused by the damaged kidneys. Fluid and electrolyte imbalances cause hyperkalemia and volume overload. Decreased bone density occurs because the damaged kidneys are unable to activate vitamin D, therefore decreasing the level of calcium. This leads to bone demineralization. Metabolic acidosis occurs and is compensated by the respiratory system. Damaged kidneys are unable to produce EPO, resulting in anemia. Sodium and volume overload causes circulatory congestion, hypertension, and pulmonary edema to the cardiovascular and pulmonary system. Other systems are affected as well. The health assessment includes health history, physical examination, and diagnostic studies. The health history or interview should include OPQ-RST, past medical history, and family history. Significant factors include heart disease, diabetes, and hypertension. Social, occupational, and environmental factors should also be included because smoking is a risk factor for CKD. During a physical exam for CKD, each system should be assessed. We may find changes to the CNS system, such as decreased level of consciousness, decreased ability to concentrate, and fatigue through observation and palpation for sensation. Monitoring vital signs is important for considering changes to the cardiovascular system by taking temperature, pulse, and blood pressure. Monitoring the respiratory system for shortness of breath through observation and auscultation help identify any changes. It's also important to assess for any signs of Kussmaul's breathing, as that is a sign of compensation of metabolic acidosis. Monitoring the GI tract by assessing the intake and output, as well as the appearance of the urine, such as how dilute or concentrated the urine is. Inspect for changes to the skin, such as infection or uremic frost. Uremic frost indicates urea crystallized on the skin. Assess for gait, weakness, muscle, and bone pain. Because of anemia, an individual may appear pale or may have bruising or unusual bleeding because of an altered hematologic system. There are multiple diagnostic studies that are used for CKD, including ABG, EKG, blood glucose, renal scans, and blood work. For blood work, you may find an increased potassium level, decreased calcium level, an increased phosphate level, an increased BUN, decreased hemoglobin, and increased white blood cell. A urinalysis test is also done, along with an ACR. GFR is used to estimate kidney function and to stage CKD. There are 5 stages of CKD to guide treatment. Stage 1 is asymptomatic. Stage 2 is decreased concentration of urine and anemia. Stage 3 to 4 is electrolyte and fluid imbalances, oliguria, severe anemia, metabolic acidosis, and azotemia. Stage 5 is end-stage renal disease involving anuria, severe electrolyte and fluid imbalance, and uremia. This will require dialysis or kidney transplant. Early stages of CKD are asymptomatic and often go undetected. Because CKD is a progressive disease, this will lead to end-stage renal failure that will require dialysis because the kidneys are unable to produce urine. Diagnosis of CKD is made when GFR is below 60 milliliters per minute for 3 months or longer. There are 2 types of dialysis, known as hemodialysis and peritoneal dialysis. In hemodialysis, a machine is used to clean the blood outside of the body. A fistula needs to be created before hemodialysis can begin. In peritoneal dialysis, the blood does not leave the body. Instead, it's cleaned using the peritoneum of the abdomen. It's important to monitor the sites for infection or trauma. Let's talk about hyperkalemia. If left untreated, can cause serious heart problems. We use Kayexalate to manage hyperkalemia. Kayexalate works by using ions so that exchange between sodium and potassium in the intestine can occur to help decrease the blood potassium level. The onset of action is hours to days. Caution: Kayexalate cannot be used as an emergency treatment for life-threatening conditions due to hyperkalemia because of a delayed onset. Kayexalate is not systemically absorbed and is excreted completely in stool. Adverse effects of Kayexalate include hypernatremia, hypokalemia, sodium retention, nausea and vomiting, anorexia, constipation, or fecal impaction. It's important to monitor bowel function, monitor EKG until potassium levels are normal, monitor fluid and electrolyte balance, monitor vital signs, assess the patient for edema, and check the diet intake of potassium. It's also important to note to not mix Kayexalate powder in foods that are high in potassium content like bananas or orange juice. Chronic kidney disease involves irreversible loss of kidney function over time and must be screened for those who are at risk. Early detection is important in preventing the disease from further complications. Lifestyle changes and treatment are used to minimize symptoms of CKD.